Bob and Brad, the two most famous physical therapists on the internet.
Hi, folks. I'm Bob Sharp, physical therapist.
Brad Heine, physical therapist.
Who you want to introduce him to?
Oh, here we have Sam.
The
Sam
skeleton.
Don't forget Gumby, but he's there.
And together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
And Sam concurs.
Well, absolutely.
So today we're going to show you how to use a massage gun on shin splints. Now, shin splints is kind of a garbage can term, meaning that they're throwing a lot of terms in there, a lot of different disorders in there.
Sure.
But generally what it refers to is shin splints there's anterior shin splints involving the anterior tibialis or tibialis anterior.
Front part of your shin.
Yep.
Right here.
So you can see I got some red mark right there.
Yeah.
A little bit higher up on the bone than posterior, which is on the inside, and that tends to be a little bit lower down in here.
And that's deeper inside.
Yeah, and so this is the anterior tibialis muscle. This is the posterior tibialis. Anterior means front, posterior means back. And in severe cases, if you have the pain here, it could also be two other muscles, and I don't even need to say them.
Right, because the treatment is
Right,
with the gun
all the same.
is
Right.
the same, correct.
Now, with this one, you may feel pain when you rise on your toes.
Yep.
Just like that, yep. Or when you evert your feet, which is turning your feet out. Yep. Now, both of these types of shin splints are exercise induced. In other words, they tend to feel better with rest. But as soon as you start walking or running, generally it's running, but it could be walking.
Sure.
You feel some burning or cramping. It's also the telltale sign is that you actually have people, you'll go in there and palpate. You'll feel in there, you'll find tender spots.
Yep.
So like, again, if it's posterior, you're going to find it right here, tenderness. Here's the bone, you're right off the bone.
Yep. It's where the muscle connects to the shin, actually, and you get some micro tears in there, which creates inflammation, pain, and it could happen like in the beginning of track season was real common. They haven't been doing anything sedentary, and then you hit it too hard.
You hit it too hard, right?
Yep.
Exactly. That's one of the common things. And you mentioned, like Brad, we're going to show on here. Here's anterior. You see the red there. That's where that anterior tibialis is attached, and it also starts to pull on the bone.
Right.
And it can pull on the outer surface of the bone, the periosteum, and you can actually get periostitis. So the bone can get inflamed.
Right.
In worst case scenario, Brad, if it keeps going on and on, you can actually get stress fractures.
Yeah, you don't want to do that.
Right. So same thing on the posterior tibialis actually attaches to the bones here and also to the interosseous membrane there.
Sure.
So, and then they come down and attach to the foot.
Right. So they're controlling the motion of your foot as well as when you run. So they're very active with weight bearing.
So what you're going to want to do is one of the first things, though, I want to warn you, Brad. Warn them, Brad. Warn you too.
Yeah, I need warning.
If you palpate and it's about 2 inches long, 3 inches long, that means it probably is muscle.
You mean the tenderness?
Yeah. But let's say it's point tenderness.
In one spot?
Yeah, one little spot.
Yep.
Like a dime. Then I'm concerned there might already be a stress fracture.
Yeah.
So
that's a little bit different.
Yeah, it's a little different.
Treatment.
I've seen this on people. We found a cross-country runner, a girl, and I said, I'm sorry, I think you might have a stress fracture. And she did. So I was right for once. So if you're going to do massage, I would recommend actually doing it before and after exercise,
Sure.
Brad. You want to prepare that muscle, make it supple so it's ready for the run or the walk. And then when you get back, do it again.
Sure.
So you find a tender spot, and once again, we're gonna massage around the area first, and then work our way into the tender spot. Now you can do stripping massage, which is basically going the length of the muscle fibers,
vertically up and down,
especially on the anterior tib, because there's not a lot of room there, Brad.
Sure.
And you can also, if you find a spot, you can do cross fiber, which Brad will show with one of these.
Right. Should we?
attachments.
Now, if they think it is very specific and it may be that stress fracture, are they still going to do some
No.
massage gun?
No.
Okay, then
You got to get it checked out.
Yeah.
If it,
I believe we have a video on stress fracture.
I believe we do too.
Yeah, so you can Google
kinda
that,
like,
and that'll get the detail.
yeah, what to look for and stuff like that. Now I've been doing my calf muscle, so I'm using a really aggressive one here. That's like the bullet one or the. But Brad, he's kind of a baby about this.
Yeah.
So.
Well, I'm a sensitive guy, Bob. So you can, start the round one if you're just starting out, particularly if you're doing the anterior tip, because you got a bone right
Yeah,
there.
right.
I would start with this
Or the
air-filled one.
Oops, there we go.
Yep. So too bad,
Yeah.
can't use that one. Hit the floor.
You got the larger massage gun, a little bit larger.
Yep.
This is the mini,
Yep.
which is really quite powerful. We're really having problems here, aren't we?
Yeah, there we go.
So, now I like to go. With that head, you probably can go right over the skin. But
Yeah.
I actually like to go over the pants.
And you can do whatever works best
Yeah.
for you. Are we going to do the anterior?
Yeah, sure. Let's hit anterior,
Ooh.
and I really feel this on me.
Oh, I believe it. Now, I don't have any shin splints, but this feels really good.
Ooh.
It just feels like I'm doing a nice job. Now, if I go directly on the bone,
Right.
it's okay with this air fill. That's the big advantage of it, but you're not going to get as
You're not
aggressive.
getting that deep, right?
Yeah. The anterior muscle is not as, you don't have to get as deep as the inside, the medial, where you're going to get the posterior, so that you have to use your own judgment.
Right.
I'm going to change to...
And that's why I experiment with different heads and figure out which one works for you.
Yeah.
But again, when you hit the certain spot, you may try going back and forth if it's a tender spot and do a little cross fiber. So
all of our guns come with 5 different heads, and so
Right.
you'll get all of these. Bob is talking. Did you talk about some cross fiber?
no, just mentioned it. Why don't you show how that would work?
So I've got the round head on. You're not going to do cross fiber with the air head. That just doesn't work.
No.
But instead of going straight into it, you're going to go sideways. The fibers go up and down. I'm going to go across the fibers.
And that works quite well.
It does, and you can get close to the bone. I can actually go over it when you're not percussing straight into it. You can really vary your intensity by the angle as well. So again, like Bob said, work around the tender spot, and as it feels better, you can go over. The first day you may not be able to get into that tender spot because
Yeah.
it's just too tender.
What you want to do is go for about 30 seconds over the tender spot. If it just keeps getting worse, it's too soon.
Yeah.
If it starts to feel numb or at least plateaus, I think you can continue then.
If the first time, give it a break, come back to it later, and if it feels better as a result of doing it within an hour or two, it's a good sign.
I'm going to show that one too, Brad.
Oh, yeah.
That one works well. A little more, if you want to get really targeted area with the cross fiber,
Yeah.
this one works really well.
Because you got an edge there.
Yeah.
Let's get this thing going here. If you don't have a gun and you're wondering which one to get, this one or the bigger one, I don't know. It's a tough choice. If you want to get the more aggressive
If you're
one,
a smaller person, you might be able to get by with this one, but this does not translate as much.
and it doesn't have these heads that we're talking
Right,
about.
right. It has different heads.
Yeah.
Yeah.
So I'm going sideways with this flat head, if you will, and I can get in pretty close and very specific on those fibers with this. So
You know what I discovered, Brad?
yes.
So I've been using a standing table now, almost continuously. Just
You mean working at a
Yeah,
desk, so you can
standing
raise it way up
desk,
and stand? Yep.
and my calves have gotten so sore just from that, because I wasn't before. I was sitting so much,
a whole new.
and they're developing the endurance now to stand all day.
Sure.
So my calves have been super sore, and these have been the answer to me.
The
So,
massage gun.
Yes,
Yep.
it has.
So we're gonna. Should we get back to shin splints?
Yeah, sure.
Okay, so you're gonna work that area, a few minutes, and once you get used to it, and it's doing well, you can go, 5 or 10 minutes. Be careful with your skin. Obviously, you don't want to irritate it. If you're older and you have sensitive skin or a rash or anything, obviously you want to stay
With
away
shin
from
splints,
that.
let me tell you, if you start feeling shin splints, that's where you want to start this massage.
Sure.
Right away. I mean, if it gets too far along, nothing's going to be able to help.
Yeah.
I mean, you're just going to have to rest and maybe ice it and let it calm down. But
Yeah.
if it gets too far, massage isn't going to help.
Right.
So you want to hit that pretty aggressive right away.
Mhm.
Especially if you're a serious runner and you have big designs on the year as far as
Yep,
records.
get after it early.
Yep.
All
All right.
right.
This video, by the way, is a part of a series of videos on massage guns. And if you'd like to see the entire series, go to bobandbrad.com. Go to the program section, and under the program section, we have programs on sciatica and plantar fasciitis. You'll see when you
Yeah.
get there.
So you go to that, and you're going to find out for calves, you're going to find out a number, I don't know, 20 or 30 videos.
Yeah,
Look
pick
at
the
the
one.
title that pertains to your specific problem. That way it's easy. It's all right there. Look at it. You can go to a PDF printout, which gives a complete review of the whole video with the exercises and techniques in there. And the whole thing is absolutely free. We don't even ask for your email.
I would probably charge any friends of yours.
Well, yeah, that's a given, and they understand that.
Yeah,
I've
all right.
told them they're going to be charged.
They have to pay a price for
Yeah.
being a friend
Well,
with
that's
you.
all right.
All right, thanks.